I want to welcome you here today. My name is Pragati Tamala. I'm the Bureau Chief for Special Licensing. I'm so glad to have you all here today. We really value your partnership, and we look forward to working with you guys as we have to fulfill the reporting requirements that are needed to make sure that we keep our mothers and children safe and fulfill the reporting requirements, like I said. So as you have questions, please let us know. We want to make sure that everything is clear. And we have today with us Claudia Montes from the Division of Special Licensing, She's an automation epidemiologist, and she's going to present for us our SurveyMonkey tool and go through that step by step with you all today. And then I'm also glad to welcome from the Office of Vital Records our colleagues Bianca Soto and Megan Whiskey, and they're going to cover our birth reporting requirements. And we also have Connie Monterosa from the Department of Environmental Security, who's going to cover the hospital paternity program. So it's a packed agenda. We're going to try to get through this as quickly as we can, but definitely participate. We want to welcome your questions. So before, I'll just go ahead and turn it over to Claudia, and we'll get started. Thank you.
All righty. Okay, so we've gone over the SurveyMonkey before, but I think it's gotten a lot better. I don't get any glitches. I'm not getting any calls, really. So I'm going to try and go pretty quickly again. I do have a guide that I'm going to email out to everybody electronically. There's a handout in the back if you're here, but if not, again, I will review it quickly on the desktop so that our participants that are not here in person can at least view it quickly, but then I will be emailing it out to everyone so you guys have a copy. So let me start there. So here, let me just find. Okay, so this is going to be a guide that I created that's going to try and mimic the SurveyMonkey, and so you guys know exactly what field should have what data and kind of the limits to what you can put into the site. So just briefly, we're going to go over it in an example on an actual SurveyMonkey online, like you guys do it every so often. With the midwife's name, obviously, both first and last names are required. It'll tell you what kinds of characters you can use, either alpha, numeric, or both. And also if there's a limit on the amount of characters that you can have in that field. So if it's required and you don't put in any data, then it won't let you proceed to the next page. It'll just say it's required. But if for any reason you put in data and it's not the correct format, it'll just say invalid. So just to note between those two different types of errors. And like I said, it goes down for every single question, and as well as notes. So things that we've talked about, this field should be, it won't cause an error if you put in a date that's over 10 weeks past the delivery date, but it is noted that that shouldn't be, that shouldn't be a date that is past 6 weeks after the delivery date. So, and again, it's every single page. My information's on there as well. And then just a reminder to print out your records. Okay. Also, just really quickly, we also have the SurveyMonkey. It's electronic, but we also have a PDF. For a lot of people that can't print out the page for whatever reason, their browser, they weren't able to document the information that they're reporting, they can actually print out a blank template and just write in their information so that you guys have a report for every client. Okay, so I'm going to try it. 1 second. Hopefully they can hear. Okay, so if you guys have any questions while I'm filling this out, just let me know. And if you are here, I really do recommend just going through the handout because you guys will see if there's an error or whatnot. So let's say I'm filling out a report. Here with the license number, it says please only enter numbers. You can't put decimals. In most cases, you guys are about 2 digits, 5. There is not a restriction, but it should be whatever number you have on your license. All date of birth, or not date of birth, all date fields have to be valid dates, but besides that, they could be in the future, in the past, they could be today. Obviously, if the question is asking about services ending or things that should be in the past, we will have somebody that's reviewing that information, but unfortunately SurveyMonkey will not indicate, hey, you put 2014 in the future, that doesn't make sense to me. All they actually will accept is any valid date. So let's see. And then your client or chart number is just a unique identifier that you guys use internally. I've talked to a couple of midwives. It could be last names, or sometimes it's a combination of birth dates. If you have any questions about private health information, we do want to just be careful. We don't use this data, but again, we wouldn't want to put Social Security information in there or anything like that. If you have any specific questions as to what kind of private health information you can or cannot use, just talk to the program. You can just call in. So here, sometimes people use, again, a combination of date of birth. Whatever you use, it's perfectly fine, as long as it's unique to all your clients. Last menstrual period, we've talked about reported and estimated. Also, with both actually number 5 and number 6, as it says on the handout, you want to use all the information that you have up until the day that you report. So if for whatever reason, mom told you, you know what, I don't really remember what my menstrual period was, but a couple weeks later she tells you, up until the report, all the information that you have, just put the most accurate the most accurate dates that you have. Same thing with estimated due date. So if mom goes and gets an ultrasound, or she consults with somebody and she comes back and says, hey, I was given an estimated due date of this and we had talked about this, using all the information that you have to try and get the most accurate date.
Elijah, don't.
Okay. For number 7, only numeric characters and integers are acceptable, so no decimals. You wouldn't need a decimal, but if for any reason you accidentally put in a decimal, it will let you know. Both are required. So for number 8, everybody's answered it pretty well. Only one answer is acceptable. And number 8 is whatever you answer on number 8, if it's not applicable, you can go ahead and skip to number 10, as the draft or as the guide will tell you. But if for any reasons anything but not applicable, you would need to go ahead and answer number 9, which I don't think is going to be relevant until later this year. So you can skip that. You can do multiple conditions here or just one. If for any reason you do other, you do have to put in some sort of information to specify what was the condition. And there is a limit of 100 characters. Services end date, again, it just has to be a valid date. Oh, here. Oh. Okay. And I'm going to go ahead. I'll go ahead and say yes, just so that we can quickly look at the demise page. Here, you would just have to indicate all that occurred, either one or more than one, and then just 2 essay comment boxes are actually not a limited amount of links that you can use in there. So everything that you want to say and relevant dates, all that information, then you would go ahead and press next. In this case, I'm just going to go back. You can go back and forth just in case you make any mistakes. I'll press no. And then when I proceed, it will go ahead and skip that demise page. Again, the guide will also let you know when you skip certain pages and when you don't, so you understand kind of the structure. Then we have the transfer of care. For these, I'm going to say yes, just so that we can go over the transfer of care. Also, I know there was a lot of questions over transfer of care. You want to call the the program to ask whether something qualifies or not. Here's a little bit of information as to what you would consider a transfer of care. Number 14 is not required, but any information that you guys want to provide relating to the transfer of care. Method, these are the 3 methods that were indicated in the regulations. For any reason, your transfer of care does not, well, you can't fill out the information because your transfer of care is unique maybe, go ahead and give us a call and we'll see what we can do with those circumstances. You want to indicate the destination, and then here you want to specify as to who the individual was or where the location was based on number 16. So Let's see here. I'm just going to be using the guide to make sure that I let you know about any limitations or validations that are in place. Okay, so for number 20, when you're actually specifying what the location or individual was, you can use alphanumeric characters, but only to 150 characters in length. For number 18, it is required, as you can see by the star, but only the transfer initiation is required. Again, you just need a valid date and time, and you should be fine. For arrival at destination, we ask if you have that information to please provide that, but it's not required. So we understand you may not know what mother got to point. Okay, so emergency action plan. If you did say yes, then you would want to go ahead and proceed to 20, 21, 22, and 23. If you say no, you can go ahead and just skip all the way down to 24. Okay, so once we clarify the EAP and when to put yes or no, if you do say yes, though, you would want to go ahead and proceed to whether the charge nurse was notified at the onset of labor. Yes or no. No, you want to go ahead and say why it's required that you put something in there, so you can, whatever the reason would be. And there is a limit of 200 characters. And again, it's only required if you say yes to 22. 24, same way. If you say if you say that you did notify the charge nurse, we would like to know the date and time. Again, just a valid date and time. Then it asks you about the EAP being used. So if you said yes, the EAP was used in number 19, you would also want to answer 22. Was the charge nurse notified at the completion? If you say no, again, same thing, 200 limit characters. If you say yes, you want to proceed with 23 and give us the date and time. If the EAP was not used, again, you go straight to 24, and that is required. You want to put any and all reasons for the transfer of care. If you indicate that it was other, you have a limit of 100, up to 100 characters. If you guys feel that these limits are too small or too much, let me know. These are things that we can change. Here, I should fill this out for you. Also, I want to just go over the printing of one of these pages because I've had a lot of calls saying it's difficult and rather the data is not being printed when I print the page, so just to show how that goes and anybody that's online can see it. I'm going to go ahead and say no for these so that I can just go ahead and skip these. And then I'll just press that. Okay, so every page will remind you to print out. And also while we're here, as you can see just by me scrolling, that if you press this right here, you're actually selecting the answer. I know that was very confusing for a lot of midwives. This is SurveyMonkey, how it's designed. Same way with these. So unless you're really paying attention, it can be really confusing, or you could be reporting incorrect data, and it's not necessarily your fault. It's just that, again, it's a difficult structure. But just be aware of that. So, okay, so now that everything is answered, I would recommend you can, if in some browsers, you will be able to go to your tools. Is it tools? Oh, no, I'm sorry. It's the little print icon. I mean, depending on the browser that you use, the print's all over the place. But I was told that you can right-click. So if you use your mouse and right-click, you will always have a print. You can do a print preview or a print. If we do print, let's see if this, no, it doesn't have an Adobe. Okay, let's do a print preview then. As you can barely see, let me see if I can, okay. As you can see, the information should be retained when you print it. I'm not sure why some midwives have said that the data, that their written text shows up, that their selections don't. I've tested it on different computers, and I haven't seen where it doesn't show. So either it being buttons or there's check boxes too. I haven't noticed. Now, if you have issues with that, you can give me a call. I can see what I can do. But, being a home computer, it's very limited things that I could do. Okay, so I'm going to keep going. No questions? Okay. I think with the print preview. I'd have to test it. I'm not really sure. This is, again, one of the midwife, SurveyMonkey functions. I think you can play with your, yeah, but it's already shrink to fit, though. No. I'm not sure, honestly. It would be just about, it's about your print options. I'd have to test. Let me see if I can look into that. And if I do get any information about, I know it is, I mean, they take one page and they distribute it in 3. So, question? If you print it to Adobe, like if you have an Adobe or a reader, you can usually just print and it'll save as a PDF, and then you can electronically save it. I mean, you're not required to print or save at all. No, but yeah. Yeah. If you have OneNote, I believe it's a Microsoft application, you can also print to OneNote. Okay, so then we get to the delivery. Again, I'm going to press yes, just so that we can go over the pages. Go next. If you press no, it'll let you know that you will skip all these pages. So, again, the first box is always free for all your writing and any information you'd like to provide. That is a comment essay box, so there really shouldn't be a defined limit of length or characters. Delivery date, again, it just has to be a valid date. Go ahead and put that in. I'm putting all kinds of random dates, so these may not make sense at all. Infant gender, we added not yet determined because of our last meeting, but I'll just go ahead and press male. Following infant measurements. So all these are required, all 3 text numeric boxes. And let me see what validation. For 29, it's, I'm sorry. Now, please note that your guide here is got all the questions. So I believe there's 45. Now, based on your SurveyMonkey, if you skip the transfer of care, the question number scheme actually gets rearranged. So you may have it's difficult for me to number any questions because it doesn't, depending on what your your event was and how the delivery went and all the information, you may not have the same amount of questions each time. Yes, question? The guide will be distributed electronically, and I'll make sure that it's online somewhere. Yeah, it's not there right now. I just created it, so I'm going to make sure that everybody gets it, and I'll let everybody know where it's posted so that if you need it in the future. And if any changes happen, we'll let you know that there's a revision and whatnot. Okay, so let me just, again, find this so that I can let you know what restrictions there are. Okay, so all fields are required using indicated scale, grams, centimeters, centimeters. Numeric characters only, decimals are accepted. Now that's something new. It used to be just whole numbers, but we've already changed it to decimals. And the value must be between 0 and 7,000. Okay? So, I'm going to make sure I have something in there. So for number 30, I want to just note one thing, that it's not in the order that a lot of people would have expected it. I had a midwife call me and ask why it wasn't small, then appropriate, then large. It was just because I thought appropriate was the most common, so I thought it would be easier. And so I had a couple complaints that it wasn't in order. I'm not sure if that's an issue that a lot of midwives feel. We could change the order, but again, I'm just addressing things that people have made me aware of. So in most cases, I just put the first one. And then the APGAR scores, you want to fill in both fields, only numeric characters and whole numbers. Decimals are not acceptable. And, sorry. Yeah, oh, there's a typo here, actually. I'm going to have to change the guide, so it's a good thing that I'm looking at this. There is not a limit in length. For number 32, here, let me fill in this. The infant's outcome, pretty straightforward. You have to pick one answer. If for any reason you do choose abnormal or complications, then you would have to fill out 33. But otherwise, if you don't have abnormal, then you are actually able to skip number 33. It's not required unless number 32 is abnormal. If you do have abnormal, 33 is a comment essay box, again, free writing for you. Oh, good point. So it's in between those two. We'll just change that. I'll change that. Thank you. I'll have to find out what category it'll go into, but so for filing date, you want to put in the date that is required. You just want to put a valid date in the date that you submitted the application.
So they signed it, they mailed it.
The date you submitted it, nailed it. Number 35, birth certificate number, if available. Again, we haven't had anybody actually submit this, but if you guys have that information, or I understand you guys actually have a really good relationship with moms, and you guys do a lot of services past the postpartum care. If you do have that birth certificate number, it actually does help us a lot. Just more complete data. Okay, so the following questions are pretty just yes and no's. For all of these, if you say yes, they're all required. But if for all of these, if you say yes, you just keep going. If for any of the ones that you answer, well, the first 4, you answer no, you do have to put an explanation or a reason why. There is a limit of 200 characters for all of these questions. Again, if you need to change that, just let me know. So I'm just going to go ahead and press yes, yes, yes. Here we have a couple of different options, but still, same rule applies, 200 characters if you press no. And just so, I mean, I'm sure you guys have seen it. Informed consent, just like the EAP question, I'll see if I can add a little note or memo like this. You want to put in the date that it was signed by the client as provided in the rule and regulation that they are agreeing to the provision of midwifery services. So usually sometime in the beginning, I'm assuming. Okay, here a little different. We expect mom perhaps not to have a medical consultation. If yes, that's when you would want to provide a reason. And again, it's a 200 character limit. Both alphanumeric characters are, you can enter in all these fields. 42 is the last box that you have. That's kind of your opportunity to provide any information that didn't fit into the transfer of care, delivery, all the other fields. So then you goes next. Okay, so now that we're towards the end here, a lot of the common errors are just dates, and I think they're just common mistakes. Unfortunately, I can't put anything in SurveyMonkey to catch those, but we are actively looking at these reports within a couple of days. So we will contact you and let you know, hey, we're either changing this date or we need you to change this date. Just realize that, your submissions dates do change slightly, but we're actually noting what are the actual submission dates and correction dates when you go in and change an error. Also, this last page has been kind of an issue for a few. With this last page, the SurveyMonkey will let us know when there's a report that has been started and has not been completed, so an incomplete report. An incomplete report is something that if it kicks you out, or in most cases is that we get to this page and that the done button right down here does not get pressed. So that's not an official submit. Every time I try to check as daily as possible, and I just go in there and submit it. The only problem is that the first time that somebody selects that done, that is the official submitted date. So if you don't press that done and I do it a few days later, it's as if you submitted it a couple of days later. If I'm on it, great. But if a week goes by or 2 and I don't press that done, then it may make the report late. There's absolutely nothing you can do with that, just to make sure that everybody's pressing that done. And also, obviously, I could actively make sure that I don't have any incomplete in my queue. But that's why I really like the guide. The last page tells you the most important thing is to submit that done because it's not submitted. And, I can't even access it outside of SurveyMonkey until it's officially submitted. Okay? And then also, I really like this page because, again, it gives you the client number that you provided. And if you don't print anything, I suggest printing this because at least you know for what client you did get to the last page. Now, again, knowing that it's not officially submitted until you press that done, even if you had this as a confirmation page, doesn't necessarily tell us that you submitted something. You could have gotten to this page and closed out. But at least for your records, you know that you at least got to the last page of the report. Okay? I think that's pretty much all I have for the report. If anybody has any questions, suggestions, critiques as to how we can improve, my information is on all the pages. I know everybody's aware of that. So, no questions? Oh, I got a couple questions. Yeah. Regarding the committee, whether they're meeting or whatnot.
I think we're going to give it a full year and then try to analyze the data to see if we can merge it or not and present data sets after the first year.
Yeah. And we're anxious to see it too. And I think in 2015 is the first requirement that we have to actually create an annual report. And so at that point we will reconvene the committee and look at the data together and help to create that annual report. But we need to collect enough data where it actually is meaningful, and we just haven't done that. There's not enough time passed yet. Yeah.
Okay. And I'm sorry, I should have repeated that question. So the question was when midwives and the committee will be able to review that data, know what's going on, how much we have. As for numbers, like I said, we have 115 as of today. 75 have been completed in my complete data set that I can actually do any analysis, but it's such few reports, we've got 75. So that was the question, and the answer is that we will be getting back to you, but the idea is to give it a full year. Question?
I just wanted to say thank you because I'm sort of technologically challenged, and I really have appreciated the way that you've been responsive and helping. Well, I know we're working bugs out of the system, but also just understanding the tools and what it can be done to go more free.
Thank you very much. Yeah, it's been difficult because I didn't have any experience with SurveyMonkey, but I understand that it was really hard also to understand what the questions were going towards. And I mean, the validation things that we've incorporated, those weren't, applied at first. And if they were, we didn't even know that you weren't able to put a longer name or whatever the case may be. I mean, there's a lot of complex scenarios and events that you guys go through that the SurveyMonkey was not able to maybe capture. So that was been the idea to just improve and improve and improve, and I'm sure that we'll be improving more. One of the other things that I don't want to go into too much, but is the client or midwives that work together, or a client that's seeing more than one midwife. Again, that is a program question that you're going to want to talk to the program about, but this report is actually for one midwife and one client. There's no way for two midwives to report on one of these surveys. So if you have any questions and you're working or you're sharing or you're transferring of care between two midwives, call the program so that we can actually advise you before you do the report what you should do and how to accurately do it before we have to go up and clean up any errors or whatnot.
But generally speaking, there is a primary person who is delivering that client's baby, and there will be one report that we're asking that's going to be submitted on behalf of that one client. So there would be a primary midwife, and even though you might have a secondary person there in support of the delivery, that primary midwife is the one who is responsible for submitting the report. Yes, and whoever did the delivery.
Okay, and I have three more questions. One more question online here is the reason the date for the end of services, is the reason the date should not be greater than 6 weeks because they want the report within 6 weeks of delivery? No. So the report should be submitted within 30 days of the end of services. And I know this is a little complex, but if there was a delivery, in many cases you guys don't deliver or whatnot, if there was a delivery, the end of services that you say that whenever you stop seeing that client for midwifery care should be up to 6 weeks after you delivered the infant. Now, whatever your end of services was, I mean, a delivery date is not always required, right? But an end of services is always required. Every time, when you put in your date of end of services, you have 30 days to hit that done button on the SurveyMonkey. So those are two independent things. I know it's a little confusing, so if you need me to explain that more, let me know, or if you have any questions, just let us know. Alrighty, so I am going to close this out, and I hope everybody saw how to print and whatnot. And then it'll ask you if you want to close and submit and whatnot. I'll say yes. See, right here, 115 completed responses. And I'm going to be sending out this template, so if you guys want to hand-filled or for whatever reason you want a PDF that's a fillable version, we won't accept this, but it's for your reference, and you guys can see the structure of the SurveyMonkey outside of the actual electronic SurveyMonkey, and then the guidelines I will be distributing as well.
And Claudia, I just want to go back to Wendy's question about the EAP plan. It is clearly spelled out in rule about identifying for every birth, every client that you take on, there must be an emergency action plan in place in general. So it was identifying all those things, and they are listed out in rule with the nearest hospital within 25 miles, the ambulance company, et cetera. But when you actually activate that emergency action plan, it says in rule is that anytime you call EMS. Yeah.
So otherwise we wouldn't
You wouldn't use it, but you would always have it in place in terms of a plan that you go over with the client to know that in this case, you know, there are rare circumstances where something might happen. Go over that with the client beforehand and always have one in place for your practice in general.
So we would hit yes every time if we have it in our practice and we have...
Only if it was used.
Okay. So
only if it was used, which means that you had called 911 or called an ambulance. Yes. Yes. And do we have any other
One more question?
questions?
Okay, let's do this last question here. Okay, can we get an idea of the type of data collection that is happening? I'm not clear if this is benchmarking or what type of data collection this is. So this is kind of reporting, and Pregnancy will answer.
So obviously, there's two reasons for collecting the data. One is to make sure that we're all following the rules and regulations and making sure that we're all, you know, that you are all practicing within the scope of your license. That's reason number one. The second reason is we always look at trending in public health about what type of data are we seeing, what types of home births are we seeing, are there any trends or interesting things that we can look at for preventative opportunities. There's many, many different ways to slice and dice the data. We do many different reports annually here in the agency. Some of you may be familiar with the infant fatality review reports. We look at data for many different reasons, and we'll just start to look at it and see if there are any interesting trends. But currently, the main reason we're looking at it is to make sure that we're not having any complications, that we are all being mindful of the health and safety of our clients and the babies that we are delivering. That's our job number one. And then the second piece is to look at, are there any other interesting opportunities and trends that we're seeing with the data, which won't be obvious probably for another year or so when we get enough data to actually look at it from an epidemiological point of view. But we will involve all of you when we get to that point. We definitely will involve the Midwife Advisory Committee to work with us to put together that report so that it's useful for all of us to look at and make sure that the standards of care for midwives that you all are interested in, as well as, you know, all of the other things that we may be looking at from a public health point of view around newborn screening, et cetera, all of those things are being accounted for. So next, if we don't have any other questions, I'd like to just go ahead and turn it over to our colleagues from the Office of Vital Records. And again, I really hope that you're finding this useful. We really put together this training because of your request and wanting to see this, wanting to be able to successfully complete our reporting requirements. So I really hope that you're finding this useful. But as always, if you have any other questions, contact us. I'll give the hard questions to Tom, but we will do our best to always try to help you be successful. So I'm going to turn it over to Megan Whitby and Bianca Soto are here from the Office of Vital Records, and they're going to go through how to provide that certificate of live birth.
Hi, my name is Megan. I'm with the Office of Vital Records, and this is Bianca. We are the trainers. And we just, first of all, would like to start off by thanking all of you for coming. We really do value our midwives as our partners, and we're also lucky to have some county partners here with us today and on the phone as well, and Connie Monterosa from HPP. We really want to all work together to make this the best possible process, so if you ever have questions, please feel free to ask us. We really do value everything you guys do for us. We know how hard you work. Thank you. All right, so today we are going to go over just a brief workflow of how it should work with the Certificate of Live Birth. And then we're actually going to go field by field. So we're going to go exactly what you can and cannot put in each of those fields. And I have some other colleagues from the state here who can help us if we get stuck on any questions for you. So the basic workflow. Birth occurs at home, attended by a midwife, right? That's obvious. Now the midwife is going to collect all of the information and complete the worksheet. Again, that's that 2003 standard certificate of live birth worksheet. Once that worksheet's completed, it's really important that you have the parents review it and sign it. Without that signature, it's not really complete and valid, okay? The midwife is going to submit the completed worksheet to the local registrar within 7 calendar days of the birth. It's really important. Every single field on that worksheet needs to be completed when you're submitting it. Otherwise, it doesn't fall within the 7-day time frame. And the local registrar will register the birth electronically within 3 days of receiving the worksheet. Once that's completed, parents can apply for and obtain a certified copy of their child's birth certificate. Does anyone have any questions on the workflow so far? Yes. 7 days. So if the birth occurred, today's Tuesday, the clock starts ticking. So tomorrow's day 1. Then, what is today? Today's Tuesday. So Wednesday's day 1. Thursday's day 2. Okay, so within 7 calendar days, not 7 weekdays, 7 calendar days, it needs to be submitted. And that means if you're mailing it by postmark. All right. Any other questions on this process? All right. I am sorry. This isn't going to be the most exciting program in the world, but by popular demand, we have field-by-field review. So we're going to start with the child's name. First off, let me just say, we do not tell parents what they can and cannot name their children. It is not our place, and we don't want to ever hear from parents that they were told they cannot name their child something. So that is a strong stance we do take. It's really important that you clearly print or type the first, middle, and last names. Spell out those names completely. If you put an abbreviation, if you put WM for William, that's what's going to appear on their birth certificate. That's going to be the child's name is WM. It's not going to be William. Proofread carefully. And again, have the parents look it over and sign it after it's proofread. If they want a suffix, please put that. You can use the abbreviation for junior, or you can use the Roman numerals 1, 2, 3, 4, etc. Does anyone have questions about that part? If no name has been chosen, this is really important. Please do not put baby boy or unnamed child. There's a checkbox up there. That's all you have to do is check that box, child not named. If there's no middle name, just leave it blank. However, a last name has to be entered, okay? So even if they haven't picked a first name yet, when you submit this, there has to be a last name entered on there, okay? And it's also really important to note that Social Security will not issue a number for an unnamed child. So until the parents have come in and changed that, they won't be able to get Social Security card, okay? Any questions? Pretty straightforward? All right. So if the child is not given a first name before the record is registered, they will need the following documents in order to add that first name at a later time, and a middle name they can do as well. So from birth to 90 days, they'll need to come in either to the state or the local registrar's office, one of the counties, and fill out an affidavit to correct. That's all they'll have to do, and they can get the child's first and middle name put on the record. If it's over 90 days and less than 6 years, they're going to need an affidavit to correct, and they're also going to need one independent factual document within the first 6 months saying that this is the name the child is going by. It could be a medical record. It could be a baptismal certificate, something saying this is what the child is going by within the first 6 months of life. Are there any questions about that? Okay. And after 6 years, they need a court order. Now, if the child had a first name and no middle name, there's different rules. So this is just for a completely not named child, okay? Good? All right. There are some punctuations that are acceptable, such as apostrophes, hyphens, and periods, and spaces. And then there's some special characters that are associated with foreign alphabets. On the back table, I had our birth bulletin that explains exactly which ones we do accept, and that's it. So don't promise, please don't promise parents a different name, and then they come into the county or the state and they're unhappy with us because we can't accommodate that. So if you're all aware of which ones we do accept, it kind of prevents some heartache for the parents later in issues all around. Okay? And again, that's one of those documents I'll make sure everyone has access to later this week. All right, so the gender or sex of the baby. This one's pretty straightforward. Either check male or female if the sex is known. Check not yet determined if it's ambiguous. Good? That one's not much. Again, a child with an unknown sex will not receive a Social Security card. So until that has been established and is on the certificate, we're not going to be able to do Social Security. Date of birth. The format we would like to see is month, day, and year. And again, the 2-digit month, 2-digit day, 4-digit year, please. Good? All right, time of birth. You have choices on the certificate of live birth. So when you're doing this, please check whether it's AM, PM, or military, and always use the local time. Even if the parents are from the East Coast, we're not going to put Eastern Standard Time. Use the colon to separate the hour from the minutes, and check AM, PM, or military. So 8 a.m. is the same as 0800 military. 1:30 p.m. is the same as 1330 military. Any questions on that one? Does that ever come up where parents want you to use a different time or anything? No? Okay. We're good. The county of birth. So enter the county where the birth took place, and please spell it out completely. Please remember, everything that you're entering on this worksheet, somebody else has to read it and has to type it into another system later. So the more you spell out completely, the less possibility of errors there are to happen later. If the birth, this is stuff that probably isn't going to happen with you very often, but just in case, I want you to be aware of it. If it takes place in a moving conveyance, a car, a helicopter, the county of birth is where the child was first removed and given medical attention. It also applies to births that occur in international airspace or waters. Again, these aren't things you're probably going to deal with on a regular basis, but just in case it ever comes up, you can say, hey, I kind of remember something about that. First removed. So, from the vehicle. No, we're saying the birth actually occurred in the car. Say they were driving from California to Arizona. The birth actually occurred in the car. The child was removed from the mother in the car, but they didn't actually take the baby out of the car at the hospital or wherever until they were in Arizona. It's an Arizona baby. Okay? City of birth is the same thing. Please enter the city or town where it took place. Spell it out completely. And the same thing, same rule applies for moving conveyances. Okay? Any questions on that? Again, these aren't things you're going to encounter very often, but just in case. The place where the birth occurred. So you're going to check the appropriate birth location. A freestanding birthing center is defined as no direct physical contact with an operative delivery center. Most of the time, I believe everyone in here is probably going to be checking home births, right? For the most part, is going to be a private residence. And you also need to answer this question. If it's a home birth, please don't forget about this question. Plan to deliver at home, yes or no or unknown, okay? We want to know, was this their birth plan all along, or is it something that just happened? And that's something that we see that gets missed a lot. That's one of those questions. It's easy to overlook. There's a lot in that box, okay? If it's not listed, select other and specify. For example, if it's on a train or something. Hopefully no train babies. Birthing facility. So if the birth took place in a hospital or a freestanding birthing center, you're going to write out the full name of the facility. If it's a home birth, you're going to put the street and number of the location's address. Does anyone have any issues with that one? Again, please spell out everything. If it's avenue, spell out avenue. If it's place, spell out place. It's just a lot less errors later that the parents and the counties have to deal with. Yeah? You already have put it previously, so you don't have to put it all there. The moving conveyance, the city, town, or location where the child was first removed. So you won't put car in this. You'll put the city, town, or location where the child was removed from that car. Again, same thing. International, probably not going to happen very often. Any other questions? All right. So, do you want a Social Security number issued for your baby? This is one of those places where we have to have a signature. If the answer is yes, the parents need to sign this in order to make it valid and for us to actually be able to ask for a Social Security number, okay? It's important to know. You need to check no for the following reasons. If the child's sex is unknown, please don't put yes, because we cannot ask for it. They will not issue it. If the child is not named, again, you're going to say no. Until that child is named, they won't be able to issue a Social Security number. If a valid address is not provided, if your parents tell you, okay, I'll just put this address down, but it's not my address, please don't ask for a Social Security card because we don't want one floating out there for a child, right? Now, if the parent's address is outside of the country, you can request that Social Security provide them a Social Security number, but it will not be mailed to them. The parents are going to have to go to the Social Security office to pick that up. Okay? We don't mail, so they don't mail Social Security cards outside of the country. Any questions? All right. Is the infant living at the time of report? So, if the infant is living when you're filling out this birth certificate and registering it, you're going to check yes. If the infant has died, you check no. This infant transferred status unknown only refers to a transfer from one facility to another. So if you have a home birth and then the baby goes to the facility, that doesn't apply because it's not one facility to another. It's a residence to a facility, okay? So on this one, you're going to check yes or no. Any questions on that? Okay. Is infant being breastfed at discharge? Now I know, home births, you're not really discharging patients like a hospital does. But the point is we want to know if the babies are being breastfed. So you're going to check yes, no, or unknown, and it refers to the action of breastfeeding, pumping, or bottle feeding. It doesn't include the intent. So just because the parents say, oh yeah, I'm going to do that, if they're not actually breastfeeding, please don't check yes. Okay? Are we good? All right. The attendant's name. So the attendant is the person who is physically present and responsible for delivery. So for example, at a hospital, if an intern delivers an infant under the supervision of an obstetrician who is present, the obstetrician is actually listed as the attendant, even though they didn't physically deliver the baby. The same thing holds true if you have an apprentice who delivers the baby. It's actually the licensed midwife who is there, who is responsible in the end, and therefore their name has to be put on as the attendant. Are there any questions about that? Okay. And please clearly print or type the first, middle, last name. Same thing. We don't want any abbreviations or anything. Okay? The attendant's title. So you'll check the appropriate box for the title of the attendant. And if you check other, maybe you couldn't get there in time and dad delivers the baby, you check other and write father if it's a police officer or something like that. We want to know who it was. Questions? All right, we're doing good. The attendant's signature. The attendants must sign field number 13 for home births or any births that do not occur in a hospital or birthing facility. Yes, correct. So if you delivered the placenta, you are the attendant, and then you're going to go on just as you normally would. However, if the father actually delivered everything, he is now the attendant, and he's going to sign as the attendant. That means you guys aren't really even going to be on that birth certificate. You're not going to be the ones to register that birth. The parents will. As, you know, the midwife giving them care, absolutely, you can help them fill it out and everything, but they're actually going to be responsible for registering it themselves. The date signed, again, same format. Please use that same format across the board. Month, day, year, 2-digit month, 2-digit day, 4-digit year. Just helps us avoid any confusion. NPI, it's Stands for National Provider Identifier. It's just something required by HIPAA for covered healthcare providers. If you have one, you're going to put it in there. If not, just put none. Check none. Are we good on that one? Yeah? Okay. The informant's name. The informant is the person who's giving you all of the parent's personal and demographic information. It's usually going to be mom, sometimes dad, or a grandparent. Clearly print or type the first, middle, and last name. Spell out the name, and do not use abbreviations, again, and proofread carefully. Is everyone clear on that? So please, best informants are going to be the parents because they're giving their information. So we're good there. Relationship to child. Check the appropriate box to show the informant's relationship to the child. Typically, it's the mother or father. Check other if it's not listed and specify that relationship. And the informant's signature. We have to have the informant's signature, okay? If the informant doesn't sign, the birth registrar or midwife may sign on their behalf. So these are rare occasions when they physically cannot sign that record. It's not just that, you left and forgot and you're going to sign it on their behalf. No, these are, if they physically cannot, for some reason, sign that document, then you would put it like this: Susie Jones, birth recorder for Mary Jenkins, or Susie Jones, midwife for Mary Jenkins, okay? Very rare occurrences. The question is, if the informant is illiterate, can an X suffice as a signature? And okay, so our answer is that if someone else who is related can sign and is literate, we want that person to give the information and to sign as the informant. We'd prefer not to have X's. If a situation like this ever does occur, please contact the state or the county, and we can help you through those on an individual case-by-case basis. If the informant's ID, their passport, their driver's license, whatever they have, has an X showing that that is their official signature, we can accept it. However, as our registry unit has pointed out, we really want a signature showing that someone has read it and understood what they are signing. So if they can't do more than an X, it's hard to say that they actually were able to review that document. So if someone is there who can do that and sign their name, please make sure that's who the informant is. Okay? Good question. Without the signature of approval, a correction letter will not be accepted. Again, that's more for hospitals and facilities, but just a good thing to know. Date signed, same thing, format, month, day, year, 2 digits, 2 digits, 4 digits. The mother's current legal name. This one can be kind of a hot topic sometimes. Please clearly print or spell, no abbreviations, all the same stuff. If there is no middle name, you can leave it blank. Now the mother's maiden name and suffix. Enter the mother's last name prior to the first marriage. So the mother's last name, this is prior to her first marriage. We have people trying to work the system sometimes, and they want their new name as this name on the certificate. However, we don't encourage that at all. Please, if you know, they need to put their maiden name on here, because it just leads to problems down the road when they get divorced or something, and then all of a sudden they want that name changed. We need the current or the last name prior to the first marriage, so their maiden name there. It's not their current legal name, it's their maiden name. Is that clear? Okay. If there's a suffix, you can enter it. Now the country of birth, enter the country where the mother was born and spell it out completely. Again, there's different places and spellings can be similar, so please spell it out completely. And social security number. Yes? Yeah, it's the country of birth. All right, so social security number. Please enter the social security number of the mother. Check none or unknown if applicable. However, we're going to talk about this a little bit later, but this is a required field, and we'll go into the rule and statute a little bit later that requires it. If you know the mother's social, you are required to report it on the birth certificate. Okay. Any questions? Date of birth, again, same thing, month, day, year. Place of birth. This is if it's a U.S. state or territory only. If the mother was born in the United States, spell out the name completely of the state or territory, and there's some common U.S. territories that you might see: Puerto Rico, U.S. Virgin Islands, Guam, American Samoa, or Northern Marianas. Okay? So that field you're only going to fill out if mother was born in a U.S. state or territory. Yeah.
Okay, so we have a couple of questions online that we want to make sure we address. Is what if they decline to give it?
To give the Social Security number?
Or yes, the social.
Okay. Again, if you have it in your records at any place, you are required to report it. If you do not have it, there's only so much you can do. However, if you do have it, you are required by statute and rule to report it.
Okay, so the midwife is required to report it if they have it in their records. Okay. Thank you.
Thank you. If the mother was not born in the United States, you're going to leave this field blank. So that's field 23. If the mother was not born in the U.S., leave that blank. Oh, and somehow 24 got skipped. So 24 is place of birth country. Or did we already go over that? We already went over that? Okay. Sorry, I got out of order. Mother's education. This is check the box of the highest completed education. So if mom's in school, she's going for her master's degree, you're not going to put master's degree. You're going to put that she already completed her bachelor's degree, highest completed level of education. Or if she's 12th grade, you're not going to put that she actually completed high school. She completed 11th grade. Okay? If unknown, you can check unknown, or there's an unknown due to parents have left the facility. It's probably not going to apply to most midwives, right? But there is that there. Most of the time, you're probably going to know. You guys have a closer relationship with the parents most of the time. Some of our other places. Good? Has the mother ever been married? So if the mother has ever been legally married, you have to check yes. If the mother has never been legally married, check no. Again, that doesn't include common law marriages or anything of the sort, just legally married. And then, was the mother married at delivery, conception, or any time between? These are your choices. Yes, no, unknown, refused, yes, divorced, yes, waiver. So if she's not married, or if the husband is not the father, you're going to need to answer question number 28. Does anyone have questions about what any of those mean?
Yes, divorce is she was married and got divorced all in the same.
Yes. And yes, waiver means that she's married, but he actually signed that waiver. Okay? Now the waiver has to be accompanied by an acknowledgement of paternity. So if you answered yes, waiver to question number 27, the answer to 28 has to be yes, that you have an AOP too, that you have an acknowledgement of paternity. Those two always have to be submitted together. And I am going to turn this over to someone else here in a minute. Does anyone have questions about these actual boxes, though? Okay. So only check yes if the father has completed the acknowledgement of paternity, and then you can complete the father section of the worksheet. It's not that he intends to complete it. It's that you actually have a completed acknowledgement of paternity in hand, and then you can add his information to the father section of the worksheet. Okay? All right, and I'm going to turn this over. Oh, sorry. An AOP or a certified copy of a court order may be submitted at a later time to add the father. They just have to go through the amendment process later. Now, for our acknowledgement of paternity, I'm going to invite up Ms. Connie Monterosa.
Yes.
Okay.
Thank you. Now, how many of you have seen what our acknowledgement of paternity looks like? Yay, good. It's pretty much self-explanatory. Whatever's put on the worksheet, needs to also be put on the acknowledgement of paternity. We have changed our acknowledgement of paternity to meet with the 2003 standards on the worksheet as well. Sometimes, usually, you'll come across where you do have the issues where the mom was married before or is currently married to somebody else, but that husband or ex-husband is not the biological father. Now, the only time that we would need something which we call the legally presumed father waiver, which was explained in the worksheet, is if the mother was married during the time of conception or was divorced, but the child was born within 10 months after the final divorce date. Any questions on that? Okay. We will also accept if mom does have a divorce decree. The divorce decree has to recognize the child and has to state that the ex-husband is not the father of the child. We have all our forms located in our website, which is azdes.gov, and you would pick under Child Services, and it will be under Forms and Pamphlets. Right there, you will be able to access our acknowledgement of paternity, also the legally presumed father waiver. We also have another form on there, which is our genetic testing application. And that's if the parents really want to get a genetic testing, we will provide the services for them. So currently right now the genetic testing costs are $97, and that's for all three parties. And the state will also provide, will also pay for all the court fees. So all the filing fees, everything. And then the courts will then send the court order over to the Office of Vital Registration or to the hospital paternity program, and we will add the father onto the birth certificate as well. The acknowledgement of paternity, what we do request is for it to be filled out with black or blue ink. I know on the top it says to fill out with black only, but we will accept blue. So if it's not available, they can accept it. It can be witnessed by yourself, or if they have a family friend that's in there, they can also have them witness it as well. We do ask that the person be at least 18 years of age and not be related by blood or marriage. And if they also want to notarize a document, they can also take the document to get it notarized. So it's really not something where they need to submit it to you right then and there. So if you get one where the parents, they're not really sure what they want to name their child, then you wouldn't really want them to fill out the acknowledgement of paternity at that time. You want the parents to first go name the child and then have the acknowledgement of paternity filed. And the only reason why is because if the parents ever come for services for child support, some of our attorneys really would like to see a paternity acknowledgement with the legal name for the child. That way they can go on with their court proceedings. We do ask, currently right now, we do ask just if the parents, I know sometimes they don't want each other's information to be given out, or if mom doesn't want dad to see her personal information, or dad doesn't want mom to see his personal information, just the Social Security, they can fill out 2 separate forms. The only thing we do ask is if mom's going to fill out her section, to at least have dad's name and date of birth on her form. If dad's going to fill out his section, just mom's name and date of birth on the top, and they can submit it in together. So you can take both forms and just submit it to our offices or submit it to the State Office of Vital Records at the time that you submit the worksheet. We do have the option with the acknowledgement of paternity, so if they don't fill it out at that time, but you already submitted your worksheet parents come back to you or, just have a follow-up with the mother, and she's like, you know what, we really did talk about it. We do want to do an acknowledgement of paternity, but now we want to do a name change. They can use that acknowledgement of paternity to do a name change for the child. So if the child is less than 3 months, on the acknowledgement of paternity, what you would want to do on the top line is put the actual name of the child that is listed currently on the birth certificate. On the second line is where you would want to do any name change. And if it's under 3 months, it's the first, middle, and last name that can be changed using that acknowledgement of paternity. After 3 months, only the last name can be changed. And the suffix is considered as part of the last name, so they can add on a suffix if they want. We also have staff that's available. So if you have any questions at the time, even if the mother is there, if she comes up, with a random question on the acknowledgement that you just cannot answer, call us. We're there Monday through Friday from 8 to 5. And we always have somebody on the phone. We also have a quarterly training on the acknowledgement of paternity. So in that training, we get more in depth, more into the legal terms, more into, what kind of scenarios if you receive this or if you receive that, or if mom ever comes with just random, because we do have those ones where mom's like, well, I really don't know who the father is. It could be one of 5. We can help you educate them on what they need to do. And you can call, our number is 602-771-8181. And you can speak to anybody there, but our supervisor is Patricia Martinez. And you can be added onto our emailing list because we do email out when our trainings are held. Also, we do email out. We have a quarterly paternity newsletters that are sent out with a lot of information, a lot of articles that are written by the State Office of Registration and also the County Office of Registration. Do I have any questions?
They're not following completely, but I hear you say that we don't have to turn in the AOP with the worksheet.
Correct.
So I got a worksheet sent back to me because it didn't have an AOP with it.
But did you add the father on the worksheet?
Yeah.
Okay.
That's what it needs.
Yes, that's when you need to. The question was, the situation was that
They weren't married at birth.
they weren't married, but are you a midwife? The midwife did not turn in the acknowledgement of paternity with the worksheet, and it got rejected. Yes, it will. It will get rejected because that acknowledgement, because you did add the father on that worksheet, that acknowledgement doesn't have to. See, what happens is if they don't want to do it at the time, you don't want to fill out the father's information on the worksheet. So later when they come back and say, you know what, I want to get this acknowledgement done, then they'll be charged the amendment fee.
So we just don't name a father on the birth certificate. We don't put anything having to do with father.
Correct.
Got it.
Mm-hmm.
Can you repeat the phone number for the program again, Connie?
It's 602-771-8181.
Thank you.
Yeah.
So if the identity of the father is unknown, just don't put any father information.
That is correct. Yeah, the acknowledgement of paternity, the only time that the acknowledgement should be filled out there at the time of birth is if the father is physically there. So say if the father is in a foreign country or he is just unavailable in another state, you can leave the form with the mother and she can mail it out to him and then he can mail it back to her and then they can submit that form in. Yeah. Yes. Yeah, the question was if they mail in the acknowledgement of paternity with the worksheet, it does get submitted to the State Office of Vital Registration. And the parents do have until before the child's 18th birthday to establish the legal paternity administratively. After that, they would have to go through the courts.
So I just want to clarify one thing. You want to submit your worksheet and your paternity through your local county office where the delivery occurs, not directly to the State Office of Vital Records. Counties have structures and units there going over your worksheets and working directly with the midwives and submitters. So we wanted to go to the county of event, not directly to the State Office of Vital Records.
And so just to make sure that everything is correct, what we have, with some of the hospitals, when they do acknowledgement of paternity, they have the parents read back everything that's on the acknowledgement of paternity and then make sure whatever's on the acknowledgement matches what's on the worksheet. That's the most important thing. Any other questions? I know it's kind of short.
This is actually on the birth certificate form then. If you mark on number 27 that the mother was married at the time of the birth, then on number 28, are we to mark something when they have not signed an acknowledgement of paternity because the mother is married? Are we marking a no there? Or just nothing?
Yes, just leave it blank. You're only going to fill out number 28 if the answers to number 27 are no, yes, divorced, or yes, waiver. Otherwise, 28, you're going to leave blank.
All right, thank you,
Connie. Appreciate her being here. And again, if you have crazy paternity questions, please ask HPP. They are very well versed in the matter. And again, just to review, so you're going to check, you're going to only check that yes, the father has completed the AOP if you have that in hand, if you actually have that completed worksheet. That's the only time you're going to add the father to the worksheet before you submit it, okay? Good? Are we good to continue, or do you guys need a break? We're good to keep going? Push through. All right. Number 29 is mother of Hispanic origin. So you're going to check not Spanish, Hispanic, or Latina if mother is not of Hispanic origin. Now, you can select multiple selections if the mother is of Hispanic origin. If you check yes, other, please specify and write it in. But you can write, you can say that she's Cuban and Mexican, Mexican-American, Chicana. You don't just have to pick one. If she is of multiple Hispanic origins, that's okay. You can select all that apply. Okay? Now, mother's race. Again, check each appropriate box. Multiple boxes may be selected. She no longer has to pick just one. If she's American Indian or Alaskan Native, enter the primary tribe and up to 3 additional tribes. So, again, that's up here. If you check the box American Indian or Alaskan Native, you're going to write in the tribe name. The primary one you have to have, you can have up to 3 additional ones. Yes.
So I get asked this a lot. Is there a percentage minimum requirement for any of these?
No. This is all self-reported information. It's what she identifies as. Okay. Again, and for the Arizona tribes, you'll see later that in field 37, we actually have the names of them for residents. So please check the spelling on those. It's right there on the worksheet for you. If you check other, you can write up to 6 other different races. Yes. Yes, so the question was, if the mother is of Hispanic origin, what do you check for mother's race? And you would select white for Hispanic origin, the piece of it. That's the race that goes along with Hispanic origin. She may be other races as well. You can select other ones as well. But please don't leave that box blank, because then it'll be sent back to you and it won't fall within our 7-day registration timeline, okay? Any other questions? Okay, and for those of you at home, the question was, if the mother is of Hispanic origin and she does not identify as white, you have to tell her that she is. No, this is self-reported information, so it's however she identifies herself. The big point here is that you do have to fill out both the mother's Hispanic origin box, whether it's none or multiple, and you also have to fill out the mother's race box. Don't leave either of them blank, okay? All right, mother's residence address. Again, if the address is not in the United States, please check the non-USA address box at the top of there. You're going to enter the house number, the full name of the street where the mother permanently resides during the time of birth. So if she's here visiting from another state, this is permanent residence. This isn't where the birth occurred. Include the type of street, if it's a street, road, or avenue. Include the apartment number or unit. You know, there are places where there are not actual street numbers and addresses. We understand that. So if you have to describe it as a location, you can do that 1 mile east of the post office. Most of the time, there's going to be a street number and a street address. So. Do not use P.O. box in this field. That will get your worksheet returned, okay? The mother cannot reside in a P.O. box, right? No one lives in one of those little mailboxes at the post office. So this has to be where she actually lives when that baby is born, whether it's here, whether it's in a different country, a different state. So the state or U.S. territory or Canada province. If the mother's permanent residence is in the United States, you're going to put the name of the state or territory. Again, fill that out completely. If the mother's permanent address is in Canada, enter the name of the province. And if the mother's residence is in a different country, leave that blank. This field is only for U.S. state or territory in Canada, territory, state in U.S. or Canada. Okay? We good? Spell out the name completely. Again, remember, someone else is going to be transcribing this. The zip code. If the mother lives in the United States, enter the zip code. If she doesn't have one, sometimes on the reservations they may not have a zip code. You can put 99999. If the mother's residence is outside of the United States, enter the appropriate postal code. Any questions on zip code? All right, city. Enter the town or city where the mother lived at the time of birth. Again, if it's outside of the United States, you're still going to enter the name of the city. You're going to spell it out completely. Especially if it's not like, you know, Mesa or something. Make sure we know we can read it, what it is. The county. Enter the county where the mother lived. If her residence is outside of the United States, enter the name of the state province. All of these instructions, too, these are coming from our instruction guide that we have posted, and you'll be getting that link. It has our fillable form and the instruction guide how to fill it out. So if you ever need to go back to this information, it's there for you. Fill it out completely. Okay, inside city limits, you're going to check yes, no, or unknown. So is her residence inside of the city? Any questions on that? All right. If the mother's residence is outside of the United States, this field isn't required. So that's only if she lives in the United States you have to answer that question. Good? All right. Mother's residence in an Arizona tribal community. Check yes or no. And if it's yes, please only check one box. She may be multiple tribes, but her residence is only going to be at one of them, right? Her permanent residence at the time she has the baby. So on this one, please only select one of those tribes. And again, this is where you can check the spelling if she identifies as an Arizona tribe member. Mother's mailing address. So you're going to fill out the mother's mailing address if it's different than the residence. If it's not in the United States, again, check that non-USA address box and write it out completely. You're going to include the number, full name of the street, include the apartment number. For mailing addresses, P.O. boxes are perfectly acceptable. And here's the good part. If her mailing address and residence are the same, you get to skip that and just check the box there on 39 for yes, it's the same as residence. Okay? Any questions on that? No? So residence cannot be a P.O. box. Mailing address can be a P.O. box. The state or U.S. territory or Canadian province. Sorry, I'm going to say province. If the mother's mailing address, again, is in the U.S., you're going to write the state or territory. If the mother's mailing address is in Canada, enter the name of the province. If it's outside the U.S. or Canada, leave it blank. Same thing that applies to the residence. Again, spell them out completely. Zip code, same thing. Enter 99999 if she doesn't have a zip code. If it's outside the U.S., enter the correct postal code. City, enter the town or city. If it's outside of the U.S., you're still going to enter that city. Spell it out completely. Are we good on all of the address information?
So
Yes.
if you mark 39 as yes, it's the same, you don't have to do the 38, 44,
Yes. Prior pregnancy information. So, number of previous live births now living. This is the total number of previous live-born infants. You're not going to include this infant. That does not include this infant. If it's 0, you're going to check the box for none. Right up there, none. For multiple deliveries, if it ever happens where you have more than one, I don't know, you're going to include all live-born infants before this infant in the pregnancy. So if there's 3 babies, this is the 3rd one, and she's never delivered another baby before, this would be baby number 3, okay? Or I'm sorry, 2. She's had 2 previous live-born infants. Number of live births now deceased. Enter the total number of previous live-born infants now dead. Again, it's live-born infants that are now dead, and do not include this infant. If it's 0, you have to check that none box in order for this to be complete. Multiple deliveries. Include all live-born infants before this infant who are now dead. Again, same thing. One had been delivered alive previously in the pregnancy and then was deceased, that would be 1. Date of last live birth. You're going to enter the date of the last live-born infant. Include live-born infants now living and now dead. So whether the infants are still alive or not, you're still going to include those. Those when you're doing the date. Again, it's a month and a year for this one. 2-digit month, 4-digit year. Is there any questions on that? All of those sections need to be filled out. So unless it's none, and then you're not going to have the dates. But if there is an answer in there, you're going to have to fill out the dates as well. So pay attention to every line on that box. Number of other pregnancy outcomes. Enter the total number previous pregnancy losses that did not result in a live birth. This includes losses of any gestation age, spontaneous, induced, ectopic, etc. And 0, if 0, check none. Multiple deliveries, you're going to include all losses before this infant in the pregnancy and previous pregnancies. Okay. Number of other pregnancy outcomes, still enter the total number of previous pregnancy losses that did not result in a live birth. And for multiple deliveries, you're going to include all losses before this infant in the pregnancy and previous pregnancies. So again, go line by line. Make sure you're filling out every section of that box. Date of last other pregnancy outcome. So if there was a previous one, you have to fill out the date. So enter the date of the last pregnancy that did not result in a live birth. Include loss of any gestation age. And the format is month, month, year, 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 year. Are we good on this? Okay. None, you're going to check none and leave it blank. APGAR scores. Enter the infant's APGAR score at 5 minutes. If the score is less than 6, you also need to enter a score at 10 minutes. If the score is 6 or more, the 10-minute score is not needed. Anyone have questions about that? So at 5 minutes, if it's 6 or greater, you don't have to do the 10-minute. If it's less than 6, we need a 10-minute APGAR score as well. If the child is born without an attending healthcare agent, you're going to do unknown, but that's not going to be the case for you guys. The APGAR score can be 0 for live birth if the infant died within 5 minutes or if the infant was resuscitated after 5 minutes, okay? So that is possible to have a 0. Just put that out there. Not likely. Birth weight. You're going to check how the weight was measured. You have choices. You can either do it in grams or you can do it in pounds and ounces. So you're going to check the box and then enter the weight. Again, that's not really going to apply for you, but if there wasn't intending, you would check unknown. Birth length. Again, you have choices. You can use inches or centimeters. Just check the box and enter the length. Any questions on those? The important thing is some of these boxes have a lot of different lines in them. It's just really important to pay attention that you're answering every question in each box. Plurality. So under the total number of fetuses delivered at any time in the pregnancy. So that means it doesn't include reabsorbed fetuses, but any live or dead fetuses delivered at different dates in the pregnancy are included. Enter this infant's place in the birth order. You'd leave blank for single birth. So if you check single, you don't have to write anything on that line there. But if you check anything else, you're going to have to write what order this infant was in. Is that clear? Okay. Prenatal information. Enter the date of the mother's last normal period, when it began. If all or part of the date is unknown, check the box and enter as much as possible. So it says date or part of data unknown. So if she can't remember the actual day, maybe she just remembers the month and the year, that's okay. Check that box and put as much of the information in there as you can. And the format, again, is month, day, and year. And then you're going to enter the, obstetric estimate of gestation. This is the best estimate based on all factors and assessments you have. So if she went for an ultrasound, the assessments that you do, your best guess as to how long of a gestation she had. Okay? Should not be based solely on the menses and the date of birth. Yes. Okay. So the question was, what if you thought it was a certain gestation length and then the baby's born and you do your newborn assessment and determine maybe the baby was actually more weeks along than you had thought? You're going to use your best estimate after that newborn assessment. You're going to use all the factors that you have at your disposal when you're doing this worksheet in order to make sure we get the best information. Does that clarify? Okay. Total prenatal visits. Prenatal care begins when a healthcare professional first examines or cancels on the pregnancy. So that's your first date, is whenever you first spoke with that mother. All information must come from medical records and enter the number of prenatal care visits in the record. So you're going to go through your records for this to determine. Don't just go by what mom remembers, how many times she saw you. Go back through your records of how many prenatal visits she had. You're going to enter the dates of the first and the last visits in the record. Again, if all or part of the date is unknown, check the box and enter as much as possible. If she's been with you for the whole pregnancy, you're probably going to have the full dates for everything, and we prefer that. It was wonderful if you do. Any questions on that? Okay. Did mother get WIC? So check yes, no, or unknown. Check yes or no to indicate whether or not you used the prenatal record to complete information on the birth certificate. So again, these are two pretty different questions that you're answering in this box. But the first one is, did mother get WIC food for herself during the pregnancy? And then the second, was the prenatal record used for completion of the birth certificate? Make sure you're answering both of those questions. Don't just go by the box and say, I checked something, I'm good. Make sure you're really reading each line of each box. Any questions? All right. Mother was transferred from another facility. You're going to check yes if the mother was transferred from another birthing facility or hospital to deliver at your facility. So for a home birth, this is always going to be no, because she's giving birth at a residence, not a facility, so she couldn't have been transferred from a different facility to your facility, right? It's always going to be no on 49. Infant was transferred to another facility. Again, this refers to transferring from one birthing facility to another birthing facility. So for a home birth, this is going to be no. If the baby was born at home, it can't be transferred from one facility to another. Good? All right. Principal source of payment for this delivery, I'm going to check whichever one applies. Father's information. Again, please, you're only going to fill out fields 52 through 63 if the mother was married at conception, birth, or between, or if the mother is not married but the paternity is established either with the AOP or with a court order. If you don't have the AOP, you don't have a court order, and the mother wasn't married, you're not going to put anything in the father's information. Leave the fields blank if paternity is not established, and if mother refuses to give the father's information, you're going to enter husband's information refused in field 52A. This isn't, she doesn't know who the father was or something. This is, you know, she's refusing to give you that information. She says, I refuse. Good? All right. Again, this is the same stuff, so I'm going to go over this pretty quickly. This is just about the names, spelling it out. No middle name, you leave it blank. The suffix, Social Security number. If you have that father's Social Security number, you are required to report it, again, just like mom. Date of birth, same format, month, day, year, 2-digit, 2-digit, 4-digit. Place of birth, U.S. state or territory. Again, this field is only if it was a U.S. state or territory. If it wasn't, you're going to leave it blank. I'm going through this one kind of fast because we've been through it before. Is everyone with me? Yeah? Okay. Country of birth, fill it out. If it was the United States, you can put USA, but, you know, you have to still put USA or United States in there. Father's education, same thing applies as mom. It's the highest completed level. Not whatever he's going for now. If he's going for a doctorate, that's wonderful, but unfortunately he hasn't completed it yet. So just put his highest completed level. Again, if unknown, it's probably sometimes more likely if the father's information might be unknown. We understand, but we want you to do everything you can to get the correct information in there and get that information for us. Father's mailing address. So you're going to fill out the father's mailing address if it's different than the mother's. If it's the same, you're going to check the box right there where it says, check here, same as mother's mailing address, and you can skip to question number 62. So best case scenario, mom's residence, mailing address, and father's are all the same. You get to check a couple of boxes, and it's a lot less work. If it's not in the United States, check the non-USA box and write the name of the country. Enter the number and full name of the street. Include the type of street, include the apartment or unit number. P.O. boxes are okay for dad because this is his mailing address. We're not as concerned with his residency as we are with mom. Okay? All right. Again, state or U.S. territory or Canadian province. If it's in one of those, you're going to fill that one out. If it's in a different country, leave it blank. The zip code, again, if his address doesn't have a zip code, sometimes on the reservations, 99999. If the father's mailing address is outside of the United States, enter the appropriate postal code. Same stuff, city, whether it's in the U.S., Canada, or another country, you're going to put the city. Father of Hispanic origin. If he's not of Hispanic origin, you're just going to check the box. It says not Spanish, Hispanic, or Latino. Otherwise, just like mom, you can do multiple selections. This is self-reported information, so whatever he identifies as. If he identifies with multiple, he can check multiple. And again, if you check yes, other, please write out what that is. Father's race. Again, you have to have the Hispanic origin box filled out. You have to have the race box filled out. Again, these are self-reported, so we're not telling them how they have to fill it out. We can tell you how they normally correlate, but self-reported. Check each appropriate box. Multiple may be selected. Those Arizona tribes, again, please check the spelling. If you check other, you can specify up to 6 races, just like mom. Same exact box. Any questions on this? All right. Medical risk factors. So you're going to check all that apply. I'm not going to get too in-depth on the medical terminology. I have some of it on here, because I want you guys to see what is available to you through NCHS, which is the National Center for Health Statistics. They have a great guide out there that'll tell you, give you definitions of each of these terms and when to check them and all that great stuff. I'm more giving you how to fill out the worksheet, make sure that it's complete. I am not a healthcare professional. I am not able to expound on these terms for you, but I have some of the definitions that NCHS has in here for you just so you know what's available to you. Okay, any questions on that? All right, so if none, you get to check none of the above, and then you don't have to fill out anything else in this box. So if the diabetes box, if the mother has glucose intolerance requiring treatment, and you check diabetes, you also have to check either pre-pregnancy or gestational, okay? So that's a two-part one. If you do check diabetes, you have to check either pre-pregnancy or gestational along with it. Any questions on that? Hypertension. If you check hypertension, you also have to check either one of the following, pre-pregnancy or gestational. You can't check both of those together. It has to be one or the other. However, you can do eclampsia with either of the above. You can have two answers to that one. It just can't be pre-pregnancy and gestational together. Does that make sense? Okay. Previous pregnancy outcomes. Check previous preterm birth if there was a previous pregnancy that ended in a live birth after less than 7 weeks gestation. You're going to check other previous poor pregnancy outcome if a previous pregnancy continued into the 20th week, resulting in any of those down below. Pregnancy resulted from infertility treatment. Again, if you check that box, that first one, check box if any assisted reproduction technique was used, and then you need to check which of the sub-items apply. And that one, it could be all three. Again, I'm going to send you guys a link to this guide that has all of this information with all the healthcare stuff because it gets a lot more in-depth. Previous cesarean deliveries. Check yes if the mother had a previous pregnancy ended in a cesarean, and if yes, enter the number of cesareans prior to this delivery. If no, you're done with that box. Are we good? So please make sure you're paying attention to each item in that box. If none apply, none of the above. Otherwise, make sure you're looking at each one and checking which ones do apply. Infections present and or treated during pregnancy. So documentation of treatment is adequate if definitive diagnosis is not in the medical record. So if she was treated or diagnosed with any of these, you're going to check them. Those are the ones: gonorrhea, syphilis, chlamydia, hepatitis B, or hepatitis C. Again, she could have multiple of these, so check all that apply. If none, none of the above. Good? Sorry, I told you it wasn't going to be a thrilling afternoon, but going through field by field. Onset of labor. If none, check none of the above. So if yes is checked for one, yes or no must be checked for each of the other two. So check yes for all that apply. Do not check both precipitous and prolonged. Those two can't go together, okay? Premature rupture can go with either of them, but the precipitous and prolonged, for obvious reasons, can't go together. But again, once you check yes for one, you have to answer the other two questions. Does that make sense? Everybody's good? All right. Characteristics of labor and delivery. This is our one where if none of the above apply, you're done with this box. However, if it's not none of the above, you need to answer each one of those questions. So if you check yes for one of those boxes, you have to select yes or no for all of the others. Even if it's no for every other single one, you need to select it for every other single one. If none apply, check none of the above again, and then you're done. Any questions on that one? Again, these are some of the definitions that are available to you through the NCHS guide. These are coming straight from that. I'm not a medical professional, so I'm not going to go into too much detail on any of that. But these are all of the things that will be available to you when I send that guide to you. Any questions? Maternal morbidity, again, refers to serious complications experienced by the mother associated with labor and delivery, occurring within 24 hours before or 24 hours after delivery. You're going to check all that apply. Again, if you check yes for one, you have to select yes or no for each of the other ones. If none apply, you get to check none of the above, and you're done with that box. However, if one applies, you need to check yes or no for each of the other questions. Don't miss any. Good? All right. Again, these are just the definitions that are available to you. Congenital anomalies of the child. These are malformations of the newborn diagnosed prenatally or after delivery, and you're going to check all that apply. So again, multiple of these can happen together. If none apply, check none of the anomalies listed. That's what I have outlined in blue there, and you're done. Unknown at this time is available, but that should rarely be used. I can't think of many cases where you're not going to know if some of these are present. I just want to make a special note of this. If you select Down syndrome or suspected chromosomal disorder, you also have to select either karyotype confirmed or karyotype pending. Okay, so if either of those are checked, there is a secondary question there you have to answer. Good? So once you get into these boxes, once you select yes or something is different, you got to read line by line and make sure everything is complete. And again, please refer to the National Center for Health Statistics for more detailed information about all of these anomalies. All right, the procedures. Medical treatments, procedures performed to treat this pregnancy or manage labor and or delivery. So you're going to check all that apply. And then I just want to point out this one, the external cephalic version. If you check that one, you have to check whether it was successful or whether it failed. So there's a secondary question for that one. The third one in. If none of the above, check none of the above and you're good. Any questions there or anything anybody wants to add? Okay. Method of delivery. There are 4 parts to this question. So there's A, B, C, and D. Please make sure you're filling out A, B, C, and D. It refers to the physical process that caused the complete delivery of the fetus. So was delivery with 4 steps attempted? Is 1 question. You have to check either yes or no. Was delivery with vacuum extraction attempted but unsuccessful? Again, you have to check yes or no. Fetal presentation at birth? You have to check 1. Was it cephalic, breech, or other? Very rarely the other. Final route and method of delivery. Again, I'm going to pick which one applies. If it was a cesarean, which obviously if you're delivering at home, probably not going to be a cesarean, right? But if it was, you have to check was the trial of labor attempted, yes or no. Okay. Again, a lot of this stuff doesn't necessarily apply here, but I just want you to see what is in our manual. Abnormal conditions of the newborn refers to disorders or significant morbidity experienced by the newborn. Check all that apply. Again, this is one of those ones where if you check 1, yes, you have to check all the other ones yes or no. So if it's none of the above, you check none of the above, and you're done. Any questions there? Please note that if you select yes for significant birth injury, you must specify the injury. So that's where that line comes in. If you check yes there, you have to have something written on that line. All right. Can everyone hear me now online? Yes. All right. So if you select yes for significant birth injury, again, you must write in something on that line to specify what that injury was. Again, please refer to NPHS for more detailed information about these. I'm not qualified there. Cigarette smoking before and during pregnancy. So if the mother has never smoked before ever in her life, not 1 cigarette in her life, you can check never smoked in lifetime. and leave the lines blank. I know sometimes a mother may have quit 20 years ago, but if she's ever smoked, you're going to say yes, and then you just fill in zeros for those 4 blanks, okay? So we need to know how many cigarettes she was smoking the 3 months before pregnancy, the first 3 months, second 3 months, and third 3 months of pregnancy. Okay? Again, it might be, yes, she smoked, but it's 0, 0, 0, 0. That's perfectly acceptable. We understand. Mother's height and weight. All fields are required in this section. Only enter whole numbers, no fractions or decimals, please. You're going to enter the mother's height in feet and inches, and the mother's weight before pregnancy in pounds, and then you're going to enter the mother's weight immediately before delivery in pounds as well. We do. So if you absolutely 100% cannot get that information from mom, if there is a situation with eating disorders or something like that going on, we do have a provision in our system. So if you write in unknown in that box, that would probably be the best scenario, I would say. So don't write in zeros or anything. Write in actually unknown in that box. We'll accept it. But please don't make that the norm. We report this data to the government, and they come back and say, you know, what's up with this? This seems fishy. We might have to contact you and say, is this really unknown? And you might have to submit a letter to us or something saying, yes, we really did not know this. So just to let you know that that's kind of our process. That's how we work with hospitals, everyone, so it could happen. Okay? The question was, if you cannot get a weight right before delivery, should you use the last weight you have if it was the week before or unknown? In that case, give us what you have. Give us the information you have. Okay, if the weight was more than a week before, if because she refused later in pregnancy, that would really skew our data. So we don't want to put a 23-week weight as her final pregnancy weight. At that point, you would put unknown for the second one. Give us what she was at first, okay? Hopefully these scenarios don't come up too often, but we understand and we do have provisions in our system because we know stuff does come up. But give us whatever information you have. Please collect it to the best of your ability. This is the stuff that helps us get programs out there that help mothers and children. That's why we have it. It's not trying to be bad guys or out to get people. Okay? Is there any other questions about this question? Okay. Immunizations, again, there's 2 spots on the Certificate of Live Birth worksheet for immunizations. The same rules apply to both fields. If the vaccine was given, you must complete all sections of each of those fields. If no vaccinations were completed, you can check none. Good? All right, so the fields that you have to complete. If it was administered, you need to tell us what type of vaccination it was. You can check either HBIG, hepatitis B, or other. You're going to enter the date that it was administered. If the vaccination was administered, you're also required to select the site where it was given and enter the lot number and select the manufacturer of the vaccine. Again, if it wasn't given, just select none. If it was given, you're required to report the provider who administered it. And that must be the name of a person. Please don't put the name of a facility in there and put their title. Box 76 is for medical record number. It can contain letters and numbers. It should reflect how you label and organize your files. So again, that's your medical record, however you label your records for mother and child. Yes? Yeah. So the question is, are you required to put the mother's name and record number at the bottom of each page where there's lines? That's more for your benefit than ours. Okay? The registered by box. You should complete this if you're the midwife who's registering the record. So this is completed by you. This is your name and phone number. If you weren't there, if you've been with the pregnancy the whole time but you weren't there, dad delivered baby, he's going to be the one that has to register that record. He would put his information there. It's really important to include a phone number here because sometimes stuff does get missed. We need to know who to contact, how to get a hold of you so we can get it rectified as soon as possible Okay? Okay. Now, I have some frequently asked questions for you, and then if these don't explain everything, you feel free to ask me a few others. We'll see. So why do we only have 7 days to register a birth? It's not because Bianca is really mean and said you only had 7 days. It's because our Arizona revised statutes say within 7 days after a child's birth in this state, a person shall submit to a local register, a deputy local register, a birth certificate for registration. And according to the rule, and these are actually the midwife licensing rules, the midwife shall file a birth certificate with the local register within 7 days after the birth of the newborn. So it's in statute, it's in rule, and it's 7 calendar days again, starting day 1 is tomorrow. If mailed, the postmark serves as the date submitted. That's for completed worksheets. If it's not complete, that postmark doesn't hold your place for 7 days, and it would be, you may be required to submit additional documents for a late birth registration if the worksheet's not complete and submitted within 7 days. Can worksheets be sent via fax or email? Again, our revised statutes require you to collect signatures. And a signature is defined in rule as the first and last name of an individual written with his or her own hand as a form of identification. So before a record can be registered electronically, we must collect the live signatures on the certificate of live birth worksheet. This is why you can't do it through fax or email. You can deliver it in person or by mail. All right. Can we register births through the State Office of Vital Records? Again, rule says local registrar, and local registrar is defined as the person whose duty includes receipt of birth and death certificates for births and deaths occurring within that district for review, registration, and transmittal to the State Office of Vital Records. So by rule, birth should be registered in the county where the birth occurred. If that county does not perform birth registration functions, there are a couple, then you register with the state. But if that baby is born in a county and that county provides birth registration functions, that's where you should be registering it with your local registrar. What if the birth is not registered within 7 days? So according to our revised statutes, more than 7 days but less than 1 year after the date of birth, we'll still register it, but a late birth certificate if the information on the birth certificate and evidentiary documents are accurate and complete and support the registration. So requirements for a late birth registration attended by a midwife. So if you attend a birth, for some reason it doesn't get in 7 days or your worksheet's rejected because something was missing, now you're out of that 7-day time frame, you still need to submit the completed certificate of live birth worksheet. It has to be signed by the attendant and the informant. You have to have a copy of the medical records for the child and the mom, and a letter on letterhead attesting to the validity of the information submitted has to be signed by the midwife. Okay? So that's if you fall out of that 7-day time frame. Additional documents sometimes may be required just on a case-by-case basis. Good? All right. What if the parents do not want to register the birth? This is the question that we had online. Again, our revised statutes say within 7 days of birth, somebody has to register that birth. Midwife licensing rules say that if you attend a birth, you have to file a birth certificate with the local registrar within 7 days. So the statute requires that all births that occur in Arizona are registered. The rule makes the midwife responsible for registering any birth that they attend. So you must submit the certificate of live birth worksheet even if the parents don't want a birth certificate. It's in statute, it's in rule. If this occurs and the parents are giving you a lot of resistance, you may want to contact the county and work with them to register the birth. Find out, if you can't get those signatures, how you're going to proceed with that. But the birth has to be registered. Yes?
Can I go back a second?
Sure.
So if you don't get it in within 7 days,
Mm-hmm.
you don't need a copy of the marriage license and a utility bill?
If you're registering it as the midwife, again, it does say additional documents may be required. I don't know the scenario that was going on with that, so I'm not going to say never, It just depends. These are the basic documents we require after 7 days. Additional things may be requested depending on a case-by-case scenario. Okay. And the question was, again, about what's required for a late birth registration. These are the basics that I have on the slide. Depending on the case, additional documents may be required. All right. So is everybody clear on we have to submit the certificate of live birth? Is that an issue that comes up a lot? Some people yes, some people no. Again, get to know your counties. We are all here working together. We want to work together. We want to support you. We appreciate the work you do. Get to know each other, help each other out, and they are there to support you and help you in these cases, okay? Do we have to use the new 2003 standard worksheet? So, according to rule, a form shall not be accepted for registration or other purposes if it omits necessary information, it's not completed using the form currently issued by the state registrar, or is not completed in accordance with instructions issued by the state registrar. So again, these are the instructions issued by the state registrar that we've been going over today. And as of January 1st, 2014, State Office of Vital Records requires all births to be registered with the 2003 standard certificate of live birth worksheets. The information that we're collecting is very different now than what was previously collected, and the older forms will no longer be accepted. Okay? Any questions on that? I'll make sure everyone gets that link to that fillable form in case you don't already have it. Okay? I promise by Thursday I'll get that out to you. Why does the worksheet require so much personal and medical data? We don't necessarily decide what's on it, okay? The revised statutes require us to implement a statewide system of vital records using the recommendations of the federal agency responsible for national vital statistics as guidelines. So that federal agency is NCHS. They create the standards for the certificate of live birth. It includes all of the required fields and instructions to complete those fields, and our statute requires us to adhere. Okay. We don't come up with all of this ourselves. We are required to go by what NCHS has given us as standards. That's why we're asking you for these particular fields, this particular information. Okay. Any questions on that? Can you speak to what new information for exactly? Yes, I will. Okay, cool. Okay, the information is used to monitor the health of the country and create programs to improve health. There was a question just a minute ago about what they use this information for, and that is the answer. A lot of great programs have come out of this information. It's all directed at helping people, helping the health of our country, helping the health of Arizonans. It's not enough to get you a thing at all. We want to put our nation's money where it can help people. More information we have in with breastfeeding programs. All of that, and that's why we collect videos. Okay? Any other questions on that? All right. How long do I have to keep a copy? How long do I have to keep a copy of the worksheet and supporting documents? And this is, again, according to statute. We need to maintain the evidentiary documents used to fill out the certificate of live birth for 10 years after the date of submission. So keep that worksheet, your copy of it, keep the supporting documents for 10 years. That's your requirement. These documents, please remember this, they contain sensitive information. Some people don't want to give it to us at all, right? They do contain sensitive personal information, so please keep them in a secure location. In our office, we have vaults and things. Nothing is left out at night. People's personal information is not lying around our office at night at all. We have systems of checks and balances in place to make sure that information is secure. And it all I know our county partners, same thing. They have systems in place to make sure that information does not get out anywhere. What if I identify a mistake after the record is registered? So, according to rule, no changes, corrections, additions, deletions, or substitutions shall be made on any birth, death, or fetal death certificate after a state file number has been given unless alterations are fully documented according to law. So, if there's an error on the demographic information, bad news is if the parent's already there, office to amend it through our amendment process. Okay. You're not going to be able to submit a correction letter on that. Is that good? You can sign off and said this is good. If you submit an error in the medical information and you can submit supporting documents and a correction letter on letterhead containing the following. So this is where you might have to submit a correction letter. You already submitted the record, it's registered, and you realize you made a mistake somewhere on the medical data. You want to correct that with the state, or maybe we kind of figure the county. Maybe someone there figured out something was wrong after this record was registered. That's something you're going to be asked for a letter of correction. This is what has to be on that correction letter. You need the date of the letter, the child's name, date of birth, the mother's maiden name, an explanation of the error, correct information. Uh-oh, I died again. Sorry, I'm running out of microphones. An explanation of the error and the correct information. You also need the name, signature, and title of the midwife. Again, that should be on your letterhead. So those are going to be usually medical data information. Are we good with that? Okay. I know somebody had asked about correction letters before, so does that answer it? When is it appropriate to check unknown on the worksheet? So I know there are a lot of boxes have unknown on there, right? You can't just check it every time. This is actually addressed in one of our birth bulletins, number 26, and it says, statistical data ultimately benefits women and infants when health programs and policies are implemented. That's what we're all about. We want to help people. OVR recognizes that there will be times when data will be legitimately unknown. That's why we have those boxes. A concern arises, however, when there appears to be a trend of high numbers of unknown data entries for the same fields. So NCHS determines what data we collect. We already went over that. They analyze it and use the results to create policies and programs. It is really important that we give them accurate and complete information. They really do analyze all of that information. And when they suspect that our data is not accurate or complete, they send a report and we must provide verification. So unknown should only be checked if you truly cannot obtain the information from medical records or the family. They check on us, we're going to check on you. If the same midwife is checking unknown for that same box on every single certificate of live birth they submit, they're going to see that there's a pattern there, that there's a problem, and you're going to start getting questions about it, okay? So give us all the information you possibly can every time. When you legitimately have to check unknown, we understand that's why the box is there. Good? All right. Are we required to submit the parent's social security numbers? Again, this is in statute. If a birth doesn't occur at a hospital, one of these people, the physician, nurse, or midwife who is present at the birth, shall obtain the information, evidentiary documents, social security numbers. That's one of the things you have to collect, and signatures are required. So social security numbers are required by statute. If you have the parent's social security number in your possession, you are required to report it as the person registering the birth. If you have it, you have to report it. The unknown checkbox should only be used when the parent refuses to give their social security number and you have no other way to obtain it. It's not in your records at all. Good? Okay. Who is eligible to receive a certified copy of a birth certificate? Again, this is in rule. The registrant's authorized agent accepts that such a copy shall not be issued unless they're 18. So the registrant has to be 18 or emancipated to request a copy of their own birth certificate, but their authorized agent can do it for them. The most common authorized agent are going to be parents, obviously, grandparents, legal guardian, adult brothers and sisters. Older adults might have adult children. They are also eligible to get a copy of a birth certificate. These are the most common ones. It's not an all-inclusive list, but those are the most common people who can request a birth certificate. Good? Did you have a question? Okay. And how do you apply for a certified copy of a birth certificate? So applications can be submitted to the state or any of the counties who issue birth certificates. You can do it in person, via mail, or vital check, and the following items are required: a signed application, valid government-issued ID, or if it's through the mail, they can also have their signature notarized on the application, and proof of eligibility. So if it's a grandparent, they need to prove that they're that child's grandparent. It might be through the birth certificate of their child, who's also listed on that child's birth certificate. They have to prove eligibility. We are a closed record state. We're not just going to give out your birth certificate to anyone who asks for it. Okay? Oh, I'm not green. Okay, I'm still green. I'm good. And they also have to have payments, and those are different depending on the county or state office, so don't ever give them a single fee because it might be different. Also, this is important. We don't give out a free copy of a birth certificate. Sometimes parents have come in and been told that the first copy is on us, and that's not true, and they're disappointed. So please don't tell them a copy because there is no free copies of the birth certificate. Good? This is just some helpful tips and information that I've gathered that's caused some problems in the past or causes worksheets to be rejected. Please make sure the information you submit on the worksheet is completed neatly. Again, the reason we're requiring you to submit this is because our system, it won't allow us to submit the record unless all of these fields are completed. Somebody has to go in there and type in all of that information. They need to be able to read it in order to do that. So the fillable form is the best way to make sure it's legible for them. If you can't use that fillable form, please print clearly in black ink. It has to be black ink, no multicolors. Okay, black ink. Are we good on that? And then just a little note, we don't share your personal information. We don't share your client's personal information. We're bound by confidentiality. The data is used to develop programs and stuff. It's not to go point out, oh, this person smoked, she's a bad mom. No, it's nothing like that. It's just purely data that we're reporting. Okay? Is there any other questions? That's all I have, folks.
And if you have any other suggestions for trainings or information that you think would be valuable or useful to you as you are practicing and you think of anything else, please don't hesitate to contact us in the Bureau. Pat Glass, Don Gibson, me, or Tom Salo. Any feedback you have for the program that you think will help us to make the program stronger, we're always open to wanting to hear from you. So we appreciate you guys giving us the feedback enough to put on this training, which I hope was valuable to all of you. The point in recording it, and I thank you for your patience through all our little technical glitches. Some of this technology is even more than we're all accustomed to. But hopefully the point of it was that we could record this session. It should be available to all of you. If you have questions, you should be able to look back on this and get some questions answered because it was a lot of information covered. So hopefully it would serve some purpose for you moving forward. We'll also put that recorded session on our Bureau of Special Licensing Midwife page on our website, along with the training materials, the presentations today, and the handouts, similar to what we did in our first midwife training session. So hopefully those will also be available and helpful to all of you as you move forward. Any other closing comments or questions that you have today? All right. Well, I just want to thank you again for coming today, for participating. We really hope that keeping the standards high for the midwives and the practice that you do here in Arizona will help all of us to make sure that we are keeping moms and babies healthy and safe. So we appreciate you working with us and understanding that the reporting requirements in rule and statute are really meant to serve that purpose. And so we appreciate you working with us to make sure that we get what we need done so that we can maintain the health and safety for our moms and babies. So thank you again for attending today. We appreciate it. And any feedback or comments, as always, please reach out to us in the program. All right, thank you very much.